Part 3, Basic EKG Interpretation with Nurse Jess. Alright guys, so if you've seen my previous videos, we've run through these first 3 questions that you're going to ask yourself when you come across an EKG on NCLEX. Now we're diving into what if one of these questions is wrong or incorrect. Then we ask ourselves, is this rhythm from atrial origination or ventricular origination? Now let's zoom into our atrial origination. Now if you recall from my first EKG video, electrical activity originates in the sinoatrial node, passes through the atrium, and lands in the atrioventricular node. So if we have an issue with our P waves, then we know that this is coming from our sinoatrial node. Let's look at these 2 rhythms that are commonly tested on NCLEX. For 1, we have atrial fibrillation. It's important to note that fibrillation is a fancy word for quivering. So in this rhythm, you're going to see no uniform P waves. They're just going to be shaking up and down. And we're also going to have unequal R to R intervals because there's lack of communication between the SA and the AV node. Second, we have atrial flutter. Now, atrial flutter is characterized by these sawtooth P waves. I have my little shark here to help you remember what those P waves look like. Now follow for part 4 where we run through ventricular origination.